New at 5, the CDC is restricting entry for some travelers arriving from parts of Africa amid a new Ebola outbreak.
Yeah, one American who was working in the area has tested positive, according to the CDC. Currently, there are at least 12 confirmed Ebola cases, more than 300 suspected cases, and more than 88 suspected deaths.
ABC's Melissa Dunn has more on the new warning.
At least one American working in the Democratic Republic of the Congo has tested positive for Ebola, according to the CDC. Health officials say the individual had symptoms and tested positive last night and was brought to Germany, where they have experience dealing with Ebola. The CDC now restricting entry for non-U.S. passport holders if they have been in the Democratic Republic of the Congo, Uganda, or South Sudan in the last 21 days. The new CDC order will be in effect for at least 30 days, but does not apply to U.S. citizens or lawful permanent residents, which will still be screened.
With limitations in resources, interruptions in aid, for example, the USAID, that leaves many of these people without the needed assistance and increases the risk of death from these infections.
Doctors say the Ebola virus spreads through direct contact with bodily fluids of an infected person and does not spread through casual contact or air.
This strain, although it is less severe in terms of the mortality, only about 30 to 40%, it still remains one of the deadliest forms of a viral infection that currently exists. That means 1 out of every 3 people who get this may die. And that comes down to the access that patients have when they get infected, the healthcare infrastructure that exists, and the ability to maintain this outbreak among those who are sick.
Public health officials are working to isolate and test cases in order to contain this virus, as there is no vaccine or proven medication for this particular strain of Ebola. Melissa Dunn, ABC News, Los Angeles.